Hi, I'm Dr. Shawn Hernser, and today I have Scottsdale plastic surgeon Dr. Paul Holden in the studio with me. Dr. Holden is here to answer questions about body image and wellness as it relates to cosmetic surgery. Welcome, Dr. Holden.
Thank you.
Before we begin, if you would give us a bit of a background about your education, medical training, experience, your practice.
Sure, thank you. I grew up in California, and so naturally I did the majority of my training and schooling out there. I went to the University of California, Riverside, and studied biochemistry for a bachelor's and a master's degree. And then I worked in the pharmaceutical research industry for a few years before I went on and applied to medical school. I attended USC, which is in Southern California, and then went on to residency at UC Irvine. Um, I did a facial plastics fellowship in Indiana, which is a optional additional year of training, usually with one of the masters in the field. And then I started my practice shortly after that here in Scottsdale. And I primarily specialize on the face, but I have a partner who does all of the body and breast surgery.
And how many years have you been practicing?
About 10 years.
10 years. So I'd like to go through a list of questions with you. The first one I have for you is, in your experience, what are the most popular plastic surgeries performed on women and men?
Well, this is on the experience of me and my partner, because a lot of them are sort of a mixture of body and facial surgeries. For women, the most popular certainly is breast augmentation and breast-related surgeries, breast lift, breast reduction. Additionally, tummy tuck is very popular, I would say. And then when it comes to the face, it's a pretty dead heat between facial rejuvenation surgeries, things like facelifts, eyelid lifts, brow lifts, things like that, and rhinoplasty, which is nose reshaping. Probably one of the newer surgeries that's coming about is what's called the Brazilian butt lift, and generally speaking, any operation that involves a transfer of fat to other areas of the body. In men, the more popular operations are rhinoplasty. They're certainly on the rise for facial rejuvenation, and then body liposuction, very popular. Probably the area that's on the rise most for men is gynecomastia surgery, and that's largely due to the increased use of supplemental steroids like testosterone. So gynecomastia is the formation of breast tissue in a male, and so the surgery is to remove that.
So has there been a change in surgeries that people are coming for since you've started practicing? What shifts have you seen? What trends?
So I alluded to a little bit, the sort of fat transfer related Brazilian butt lift, those kinds of things. But in the populations themselves, you certainly see a rise among men. That's the most rapidly growing population. And that's probably more due to the fact that baby boomers are aging and they're healthier. The men in the baby boomer population are healthier. The other thing that I've seen, and I think it's been studied, is that the general taboos about getting plastic surgery, either on the face or the body, just have been steadily going down. So a lot more of the population is getting involved in different forms of aesthetic improvement through either surgery or minimally invasive procedures. And so those are the things that I've seen.
Okay. Is there an age group that's more likely to seek plastic surgery?
That's a good question. Depending on the type of surgery, there certainly is. So in the primary breast augmentation, so that's someone who's never had implants placed, or primary rhinoplasty, someone who's never had surgery on their nose before but wants to improve. Those ones, generally, it's the 18 to 26 age range. And obviously the breast augs are to a large degree female, and the rhinoplasty is a near split that favors the female population. So it's probably about 60-40 for the rhinoplasty. But then if you get into the later decades, so starting in the mid-40s onward, you see another peak, and that's with the facial rejuvenation procedures. And those could be minimally invasive, usually at the very early ages, so maybe even our late 30s, early 40s, and you start getting into the more invasive procedures as you get further up. The peak of that is probably in the mid-50s to early 60s, but it drops off sharply as you get towards 70.
What about trends for men?
You know, men, primarily what we're seeing are the rejuvenation procedures. So they might be doing things like lasers, lifts.
And this is facial.
Facial
right?
surgeries. And, they might do, like we do see a decent amount of men that are getting body liposuction and maybe even a tummy tuck. So if they actually lost a massive amount of weight, maybe they will have, and I do see it, enough change or enough laxity in their abdomen where they want to get that tightened up, and not just have loose skin. So the men tend to be taking care of that a little more. It's still the most rapidly growing population in the plastic surgery world, but it still only makes up about less than 20%.
Oh, that's interesting. Okay, so are patients typically satisfied with their post-surgery results? What do you see?
That's primarily based on selection. So what I see in our practice is, yes, the majority are satisfied. And, that's something that, in our experience is something that we do play a big role in prior to even conducting the surgery.
We're going to elaborate on that a little
I
bit
think
more,
there'll be more
as we
questions.
move forward here. The next question, what do you think drives people the most to seek plastic surgery?
I can only draw on what my experience is, and it does depend a little bit on their individual life experience. But for the majority that actually go ahead and go through plastic surgery, it's an internal drive. So it's very similar to the process by which a person might put themselves on a diet or start exercising more at the gym, and they're in a mode of self-improvement. Only these are areas that they are not able to improve with exercise or diet. So you can't change the shape of your nose doing those kinds of things, or you can't tighten your own face or things like that. Okay, make your breasts larger. Now, among them, there always are those that have sort of more worrisome motivations versus those with the more internal self-satisfaction motivation. But in the idealized patient, that's what we look for.
Excellent. Some people feel that cosmetic surgery is a Band-Aid and doesn't address underlying issues regarding why people seek to change their appearance. Would you agree or disagree with this statement, and why?
Well, obviously I've chosen this as a career, and if I thought it was just a Band-Aid, I wouldn't be doing it. So there are people with underlying issues that might seek plastic surgery as a symptom of their issue, and for those people it just wouldn't be appropriate. But the majority of people going into it have a very concrete idea of what they're pursuing. So and what this has to do with is whether that individual's motivations are external or internal. If a person has an internal motivation, just like the gym again, if a person decides to go to the gym because they want that improvement for themselves, they're going to derive satisfaction out of what they do. And similarly with plastic surgery, if they are doing it for their own internal motivation and they have realistic expectations, they will be able to derive satisfaction out of that. On the other hand, if they are expecting, if you go to the gym and expect that, hey, if I work out a lot, I'm going to get the promotion, I'm going to get the girl, or I'm going to get whatever other external thing in my life. Maybe I'll have more friends. And all of those can happen similarly with plastic surgery. That person is very likely, in fact, almost certainly going to be disappointed by that. Now, when it comes to the gym, so what? They stop going to the gym. But when it comes to plastic surgery, they've gotten involved in something that most likely they can't undo. So it's a little more serious consequences. But in the properly motivated patient, it's an internal quest for self-improvement. And no, it's not a Band-Aid. That's as long as they've communicated clearly what their goals are and they have reasonable expectations, they will have success and move forward in their lives.
Thank you for that thoughtful response.
Mm-hmm.
So, do you think a psychological assessment should be a standard protocol prior to any patient receiving cosmetic surgery? Why or why not?
Well, I think that when you get into the term psychological assessment, I think any physician practicing cosmetic surgery should be performing an initial assessment right at the gate when the patient walks in the door. So there's a sort of a tongue-in-cheek term that we use for cosmetic surgery, and that is we will say that it's psychosurgery. And that doesn't mean we're psychos and we're doing surgery. It means that there's a psychiatric component to this field, which is surgery to help someone feel better. And so clearly, if there's an integration between psychology and the actual surgical performance of the surgery. So in my personal practice, that initial meeting, starting with the very paperwork that they fill out, is a psychological assessment or a process to develop, kind of categorize these patients into whether they're appropriate or not appropriate for surgery. So I absolutely do believe in it. I wouldn't practice any other way. Do I know that that's happening all the time? I don't know for sure, but I doubt it. I think there certainly are situations where it doesn't, and woe be to the surgeon that doesn't engage the patients properly. And if they're not capable of doing that, then perhaps they should engage in another a psychologist, therapist, or some other expert that can help them do that.
That's a great segue into the next questions. So what would you consider to be an emotionally healthy approach to cosmetic surgery seeking behaviors? How would you describe this mentality on the part of the patient?
Well, it does vary a little bit. So I'll use an example that I haven't already used, and I'll just say that if, for example, the rhinoplasty patient, the majority of them, and this is not broad strokes, I'm just using my experience. Okay. But the majority of them, right around the age of puberty, became disenchanted with how their nose looked in terms of with proportionality to the rest of their face. Maybe it's too small, maybe it's too big, maybe it's crooked, maybe it's very eye-catching. It has some particular aspects to it that draws attention to it. And at that age, at that developmental age, that person can feel very insecure about their nose, and even become obsessed with their own nose and the noses of the people around them. And so when that person walks in the door, at that point, I'm trying to determine if that patient has a more healthy approach, which is more self-acceptance, but a concrete and realistic understanding of what is available in the world of rhinoplasty, versus that person that has become so down on their life, and so maybe they have other side issues like depression or anxiety or things like that they're sort of hoping that this is going to be a Hail Mary pass that's going to resolve all their life's problems. In the healthy patient, they may say, well, this has been an issue for a long time, and really I'm fine, but I'm at a stage where I really want to take care of this. Whereas and it's all about them and their internal feeling about it. In the unhealthy situation, they could just be like, well, I've been punished from birth because I got my dad's nose. It's terrible. I can never get dates. I can never, get the jobs I want. People don't ask me to go do things with them. I can't get friends. Things like that. And of course, you and I both know that their nose would have nothing to do with those things, but perhaps how they feel about themselves and in those situations, has projected or repelled some of the opportunities in their lives. And I wouldn't suggest for a minute that would be a healthy approach to plastic surgery. When it comes to the aging patient, it's a little different. And the way I put it is this: nobody would see fault in a child who's been injured in an accident, getting plastic surgery to reconstruct that to as close to their original form as possible. And I think most people would not argue with that effort. Because there's a certain level of innocence to that. When it comes to aging, we're all in a slow speed collision with the sun. We're all under oxidative stress. And there are genetic parameters too that are going to degrade and degenerate and cause loss of elasticity, changes in our appearance. And in some people, that really just makes them feel disconnected with how they feel on the inside. And so if a person says, well, I'm developing a dour or sour look, I'm looking tired, and people are misunderstanding me. Maybe even in a professional setting, they may feel that, I'm competing with other people that, look younger, and I don't have the look, and I'm not getting the same response that I was before. They may feel to be more competitive, they want to do that. I think all of those are realistic reasons, and they're all very solid, so long as, again, their motivations are internal, and they're not expecting some sort of external result. So, if I hear that sort of thing, I might redirect them and say, well, are you expecting this to improve your income or something? And that question is a separator for me on whether that person is really appropriate for surgery or not.
So this leads to our next question. Would you ever advocate against a patient having cosmetic surgery? If so, what types of circumstances would warrant this?
So this happens frequently. I mean, the initial consultation, most people come into the initial consultation, their approach as a patient is, I want to hear what he can do for me and what it's going to cost. Before I walk in the door, the only question I'm asking myself is this patient appropriate? Yes or no? And I was told at a very young age, when I first started out in practice, I met a much older surgeon who was at the tail end of his career, and I said, what advice do you have for the new surgeon? And he said, just remember, when old surgeons get together, we don't talk about the patients that we didn't do surgery on that we wish we had, but we do talk about the ones that we did do surgery that we wish we never did. Mm. And that's not because of how the outcome was in the operation. That's because of the psychological outcome with that patient. So when I'm looking at, of course there are medical factors. Some people just they don't meet the medical qualifications to have surgery. If they have a heart condition, lung condition, clotting disorder, things like that, they may not be appropriate for any type of cosmetic surgery. There certainly are the psychological components to it, which is, as I mentioned, any disorders that are really untreated or out of control. So anxiety, bipolar disorder, depression, and then of course body dysmorphic disorder, unrealistic expectations. So you can have a person who is psychologically healthy, but they walk in with a picture of, Kylie Jenner, and they say, just turn me into Kylie Jenner, and if I say, well, no, that's not how this works, maybe they say, oh, I know that, I'm just kidding. Or they may say, what, you're not good enough, you can't do that, or something like that. And if they say that, already I know that this person is not appropriate, at least not at this stage in their life. They're not appropriate because their expectations aren't realistic. So those are kind of a lot of the things. There are more sophisticated criteria. For example, many surgeons will refuse to do any cosmetic surgery on men. I'm not one of them, but for various reasons, they'll say don't operate on men. I think that you treat men and women, you still go through that psychological evaluation.
Can you share a bit about some of the various reasons why some choose not to operate on men?
Well, early in training, there was this sort of, and this was in my training, but it's in the textbooks, believe it or not, that the patient to avoid is the single, immature male who's overly narcissistic.
That's textbook?
It's in a textbook, Simon. Single, immature male, overly narcissistic.
Wow.
And the reasoning is you won't make this person happy, and they may even become violent if you operate on them. Now, the pure number of men that I've operated on that are single, male, and narcissistic, that's a high number. The immaturity is something I do definitely avoid. And there are other factors, unrealistic. So it doesn't spell a name anymore when I modify it to my criteria. But I think if they're unrealistic, or they're, and it's the same for women, or they see something that I don't see, they'll say, you see how this side's slightly bigger than this side? It's off, or my nose is crooked and it looks straight to me. These are things that point to a little deeper problem that can't be fixed with surgery. As a last thing, I'll just say that men are generally non-compliant. It's much, and I don't mean this in a sexist way. I just think that my experience with men is that I have to be really, really forceful about the issue of proper rest, refraining from certain types of exercise and straining and things like that after surgery. Mm-hmm. Whereas many of them will still do it. Whereas with the female population in general, the percentage that will not comply with that is much lower. For men, depending on the age, in the 20s, males in their 20s, sorry guys, males in their 20s generally don't like to follow instructions.
Do you have a theory? What do you attribute that to? What are your ideas? Is it just maturity?
I don't think it's a maturity thing. I think that there's a tendency among men in general when they're hurt to wait until they feel better and then go back to doing what they do. So, and I just think it's, I don't know, how they're raised or whatever. I'm not really sure. So, right around day 3 from surgery, most people start feeling better. But you're supposed to rest for a week or 2 weeks or 4 weeks. But a lot of these guys, they'll get around day 4 and they'll think, you know what? I need to clean out the garage. I'm bored sitting around the house. And they go out and clean out the garage.
I don't know anybody like that, by the way.
I meet them all the time. Yeah.
That's really interesting. So this is a great segue into the next question, which is, how would you go about explaining to a patient that they're not a good candidate for surgery? What does that look like? It
varies less and less as I've gotten older and practiced longer. In the old days, I was more avoidant. I would try to quadruple or quintuple, depending on how much I wanted to avoid this patient. I would just have the coordinator charge them a much, much higher price to scare them off. Because I was hoping that it wouldn't make them angry.
Because it's uncomfortable.
Yeah,
right?
But it also makes them angry when you overcharge them. So it turns out they don't like that either. Especially if they go, I was sent here by Linda, and Linda paid 1/5 of this, and then you're stuck. And the other thing I realize is that I do have an obligation to treat these people, or at least help them get help. And so now I actually just say the phrase, I don't think you're appropriate for surgery at this time. And sometimes they'll say why, or what is it that's making you say this, and I may or may not tell them more detail. If I'm afraid that they'll respond or become violent or get upset, make a scene in the office, I will just say, I don't think I can help you, and I don't think surgery's right for you, and I'm sorry, but I can give you a list of other offices, but I can't treat you.
I'm glad to know that you're firm about that.
But I will, if in the majority of cases, I will tell them, well, you're not appropriate right now. I don't think that from a standpoint of mental health that you're there. But I do have a friend who's a psychiatrist that I will refer you to. And when he says you're ready, you can come back and we can continue this discussion. And I give out his card. And some of them will take it, some of them will seem a little off-put by it, those kinds of things. But I've never had anybody get upset or have a big outburst about it.
I love it that you care enough about their emotional well-being to put that first before you'll perform surgery. I think that's excellent. It's an excellent standard to follow.
Some actually do end up back. I've had some that came, but it's probably about 1 in 20 that actually will go and see him and get involved in therapy and go through a whole process and come back with a much better perspective on things, usually with a very different request for what they want.
Interesting. Okay, we're almost done with this interview. Thank you for your patience and for answering all the questions so thoroughly. In your opinion, do cosmetic surgeries improve a person's self-esteem? You've touched on this a little bit, but just to directly respond to the question.
Yeah, well, I would say that it's not surgery to improve their self-esteem per se, but it's to help with either their confidence in how they're being perceived, or their it's internal confidence in terms of a specific issue. Most of my patients, the vast majority, I can't ever say all of them, but the vast majority, in my opinion, do have very high self-esteem. They come in, they feel good about themselves. They have a little bugaboo that they want to address. So I don't think they're coming in to feel like they're a more worthy or worthwhile person. Now, that being said, certainly do I see a glow afterwards? Do I see them a little more confident, a little more balanced afterwards? Yes, I do. But the ultimate goal is just to help them with the specific concern that they feel is something that they would feel a little more harmonious if it matched how they feel on the inside.
So would you ever consider getting plastic surgery yourself? And have you ever performed any plastic surgery on yourself? Why or why not?
Well, I don't perform it on myself, but yeah, I've had a few things done, and I, of course, kind of think I want to go my whole life and look fabulous. So, you know, I'm no stranger to it. I'm in it. This is my industry. I do also use Botox. I have a little bit of filler. I've had laser procedures, but this nose is not the original equipment.
Really?
It is not, and that was done and then revised and improved upon, and that actually kind of set the stage for me wanting to go into this field, because the first two surgeries were not successful. They actually made the situation worse, and then I got to someone who was more of an expert, a facial specialist like myself. I managed to get it addressed and looking the way I wanted it to look. That experience, both the negative and the positive, really shaped my view on what I wanted to do with my career, and what I'm passionate about. So yeah, I absolutely have been in it, and I plan on continuing to do it.
Thank you so much for sharing your passion with us
Oh, sure.
in the studio today and for answering all of our questions. Before I release you and let you go, would you let everybody know if they wanted to reach you, could you tell them a little bit about your practice and how they might be able to contact you, what that would look like?
Certainly. Our practice, which is actually called Scottsdale Plastic Surgeons, is located in Scottsdale. It's near the Scottsdale Quarter. We have a website. It's scottsdaleps.com. Very simple. And our phone number and everything's on the website. We're open 5 days a week. There's me, for face, and my partner does everything else. We welcome everybody in, and for a free consultation, or just to kind of check out the office.
Thank you so much, Dr. Holden. We really appreciate you being with us today.
Thank you for having me. I really appreciate it.